Greetings, ladies and gentlemen, and welcome to SBAH Radio Podcast. I'm your host for today, Olesego Rankatiso, and on today's episode, we're going to be talking about breast cancer. The month of October is designated by the International Health Calendar as Breast Cancer Awareness Month, also known as Pink Month. This campaign focuses on early detection, reducing stigma, supporting research, and promoting prevention strategies like a healthy diet and regular physical activities. Joining us in the studio today is Sister Nonhlanhla Mabena and Sister Bongiwe Petelo from the Medical Oncology Clinic, and also Sister Margaret Pete, who is the Operational Manager from the Medical Oncology Outpatient Department. Sisters, welcome to SBAH Radio and thank you for joining us.
Thank you.
Thank you very much.
To start the interview, or to start this episode, what is breast cancer and why is breast cancer awareness important?
Okay, thank you. Breast cancer awareness is very much important. We usually do it in October. This is for breast cancer awareness. That is our month. It's whereby we raise an awareness to everyone that they must know their bodies better than before, especially the breast. And it's whereby where we support those who are suffering from the disease already, and then we honor those who died from the disease, as unfortunately. That is why it's very, very much important to us. And sometimes we raise the funds to support for the survivors from breast cancer. And then with breast cancer I can say is a disease whereby it occurs most of the time in women than in men. I'm not saying that in men it doesn't occur. It does, because men also have the breast tissues. And then with the breast cancer is where there is an abnormal division of cells. They divide abnormally and then rapidly so. And then when they divide, they accumulate and form a mass in the breast. Is whereby you can see that there is a mass in your breast because there's this division of cells and then they accumulate and form a mass that it can be palpable when you palpate it on your breast. So it is very much important to make an awareness for everyone that you need to not to be scared to touch your breast. You must touch your breast so that you can able to identify those abnormalities, those lump or those mass in your breast. And then don't be scared also to look for your breast. When you are bathing, you need to look for your breast for any changes that you can observe on your breast. Because if you know your body, it's going to be possible that you can observe any changes that can occur in your body. And then the last thing, you need to also check for any abnormalities. When you look and then you check for any abnormalities, whereby if you can see those abnormalities, you can go to the GP for further management or go to the nearest clinics so that it can help you further.
Okay, so what are the signs and symptoms of breast cancer?
Good morning, everyone. Dumelang, goeiemorgen. The signs and symptoms of breast cancer are the following. You will have a change in your size or the shape of your breast. You will have a lump or a swelling in your breast. You will have changes in your breast skin, like dimpling, like your breast being like going inside, your breast being pressed or collapsing inside of your own breast. This breast collapsing, going inside, and you can have edema, swelling in your breast. You can have something like ulcers in your breast, and you can have nipple charges. What is nipple? Nipple is where the milk of a baby comes when the baby sucks. That black part of the breast, something will be coming out like water, like blood, like discharges that is having a dark color. That is nipple discharges. And you can also have unswelling unusual swelling under your armpit, under your arms, edema, what we call lymph edema. These are the signs and symptoms of breast cancer.
So what are the risk factors?
Actually, cancer doesn't have a cause. It is having risk factors. What do we mean when we say risk factors? Risk factors are those factors that can lead a person to have cancer. So one of the risks is the age. It increases with the age. That's why we are always telling a woman that at the age of 40, start going to the hospitals to do mammogram. Somebody can ask, what is mammogram? Mammogram is an X-ray sort of with low dose that can detect or pick up when there's cancer in your breast. And the other risk factor is what you call early menarche. Somebody can say, what is early menarche? Early menarche is when a woman experiences menstruation at an early age, maybe at the age of 11 or at the age of 12. And the other risk factor can be nulliparity. What is nulliparity? Somebody can say, what is nulliparity? Nulliparity is when a woman doesn't have children. The breast can be affected. Or when a woman gets pregnant after the age of 30 upwards. According to the book, according to the health experience or the health research. The other risk factor is usage of contraceptives. I can say with our own language, barba prevent. Basadi barba prevent. Usage of those contraceptives at the early age, maybe at the age of 20, and taking long, more than 6 years, using those can also be a risk to your breast. And another thing that is commonly happening in our community, ingestion of alcohol every day. If you are taking 2 glasses, when you are saying, I'm tired, let me just make myself comfortable, taking every day, taking those 2 glasses of alcohol, it can be a risk also to your breast to have breast cancer. I think I've already touched everything. Thank you very much.
Thank you, Sister Pete. So what are the different treatment options available to our patients?
Okay, good day listeners, I'm Sister Petelo. Thank you for having us at SBAH Radio. Breast cancer treatment option may vary depending on the type and the stage and individual factors. So we have following treatment options. We have surgery where they can do the mastectomy, they can do the lumpectomy, they can also do a breast conserving surgery. We also have chemotherapy. Is where they give you chemo before surgery. It can be done before and can be done after surgery. We also have radiation. We can also do both chemo, radiation, and only radiation sometimes. But if we do radiation, they only do a external beam radiation. They do the outside of your breast, and also they will do the internal radiation, is where they do brachytherapy. They plant the seed near the breast. So there is a hormonal therapy that we also do. It's where the patients are given tamoxifen for the hormonal treatment. We have immunotherapy. The immunotherapy medication that stimulates the immune system to fight. We have combination therapy using multiple treatment. That means when it's like that, is where they do the surgery, they do chemo, and then they do radiation. That is the combination.
And in closing, what advice would you give to our listeners watching at home?
Okay, in closing, what I can do, what I can say is, by working together, we can promote breast health, support those who are affected by breast cancer, and strive towards a future where everyone has access to quality care and treatment. I thank you.
Thank you so much for joining me, sisters. Breast cancer awareness is crucial because it promotes early detection through education on signs, symptoms, and screenings, just like we learned today about mammograms, which improves treatments, outcomes, and survival rates. It also reduces the stigma surrounding the disease, encouraging open discussion and timely medical consultations. Get in touch with us on our Facebook platforms and all our other social media platforms. Let's talk about your experiences with breast cancer. We want to hear from you. For SBAH Radio, my name is Olesego. Till the next episode.